Everything works. Yes, beautiful. Hi. Okay, we're gonna do some like just regular shit first. We're gonna be doing some amboss as per usual. I mean, do we even really need to talk about congestive heart failure? I feel like most of us already know it. But I mean, if there are any questions like that come up, let me know. I can answer them. I'm gonna do like the usual stuff that we do at the start, which is mainly do the thing so that Twitch doesn't like have my head whenever I do the thingy. And if I do the 3 minute pre rolls at right now, if I do my 3 minute pre rolls right now, then there won't be any issues later. But okay, let's get this. Let's get it started. Let's get it started. Let's get it all started. Started. But yeah, so give me like 2 seconds to get everything set up. But yeah, so hopefully everything is working on my end. Hopefully. I really don't know yet. Is my chat box even working? Ooh, that's important. Ooh, that's important. Where's my chat box at? Huh? That's why. Where did it fucking go? Come on. Huh? What if I... Hi. Yeah, my chat box is kind of borked. I'm gonna delete the source and then put it back. But hi Kai, how you doing, buddy? Then if I make this like 400 by 400, 400 by 400, it'll all be working. I think. I think. Perfect. Hell yeah. Hey, nice. Awesome. I I'm doing good. I'm doing the usual. How's my audio, etc., etc. But hell yeah, glad that you're doing well on Twitch. Or you're doing well enough to like be on Twitch right now. Yay. Yes. Oh, so this model is fun. I like how bouncy it is. If I could get like my if I could get like a main model, or like if I could mod retexture this enough to look more like my actual design, that'd be fucking awesome because I like the bounciness and I like the fluidity in this thing. It's really cool. But yeah, so there's that. I also figured out how to make it so that my actual mouth movements are captured better. It was a very stupid and simple fix. Literally, all I had to do was just connect the thingy, connect the iPhone thing to VTube Studio. I had to connect like the V-Bridger thing to the VTube Studio, so it was a pain in the ass for me. I didn't realize it was gonna be like that. Oh well, back to questions. 70-year-old man has evaluation of worsening fatigue, nocturia, and shortness of breath on exertion. Okay, so he has really bad fatigue, orthopnea, hypertension with daily amlodipine and prazosin, but he is not very adherent to it. Pulse is 75. Blood pressure is okay. He's tensive. Oh, yeah. Rails and S4 Gallop. Further examination is going to show Oh no, you're gonna be in a. Oh my god, wait. I mean, this will be that, right? Wait, what? Let me see. Oh, okay, because I was like tied between this or that, because like, ah, well, that's fine. Yeah, because like there's hypoperfusion, but there's gonna be hyperkalemia. Well, he's gonna. Oh, okay. Well, he's gonna have hypokalemia because of the increased aldosterone, and etc. 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 Oh well. 38-year-old woman comes to physician. History of antiphospholipid syndrome. Pulmonary capillary wedge pressure of 10. Wait, oh, this is right-sided? Fuck, then that's this one. I thought this was left-sided the whole time. Hey, Japung. Wait, oh my god. First time chat. Hello, welcome in. I do not know if you know me, but I am a, oh my god, what was my whole fucking spiel? I already forgot. I am a second-year med student, constantly exhausted, and I am a VTuber. And I am like this close to crashing out. I got it. I kind of remember. How are you doing? Yes! Oh my god, yes I do. Oh yeah, you were there for when I realized what support meant. Yeah. I... Shit. I didn't know. I didn't know that's what it meant. I didn't know. Yeah. Well, I didn't know. I did not know the slang. Literally, I just learned how to swear in Tagalog. So, I know how to swear in Tagalog more than I know, like, just regular slang or, like, other shit. Like, medical terms that I need to know. Other than, like, tigdas and beke and bulutong. That's it. That's all I know. I also know alta presión and diabetes. But that's kind of it. But yeah, how are you? Yes. Well, so we're gonna have neuro like I think second semester. Like we're still on cardio. We're like on we're like on cardio right now. Also, by the way, is it spelled like that or is it like diabetes with an instead of the I? I low key don't remember now. But okay. Ooh, for a long-term survival, this is probably gonna be. So, he's tired but in no acute distress. He has. So for long-term survival, this is probably gonna be. It's probably gonna be like amlodipine. Oh no, is it digoxin ba? Oh, was it metoprolol? Okay, okay, damn it. Jabet, diabetic, huh? What? No, you really legit? My God, fuck. That's crazy. Okay though, I didn't. Okay, that is funny though. Like, wait. Okay though, dead ass. I have a question. Like, why is high blood the hypertension one, but low blood is the sugar one? Like, it's so confusing to me. I don't get it. I don't get it. So it's digoxin. This is for reduced ejection fraction, I see. Dobutamine is the inotropic agent with severe left ventricular systolic dysfunction for MI, but it's not used chronically. It was asking for chronic. Okay, I knew what that was. I'm redoing this one. Damn. Ah, I see. I did not know that. I'm still learning terms. Pulse is 110, rest beats are 20, so he's tacky. This looks like high output cardiac failure. But yeah, so like we're currently in the neuro module, or not neuro. Oh my god, why did I say neuro? We're in the cardio right now. I'm just doing some Q bank questions to prepare myself for when I have to do this fucking case study. Like that's due Wednesday. I have to do like a drug part on it. So that's what I'm doing today. Basically, this is what I'm going to be doing. I am doing this in order to motivate myself to actually do my homework. And it usually works. Like dead ass it usually works, which is really funny to me. Okay, where's my case? There's the questions. Troponin levels are elevated, EKG, SC elevations, precordial leads, revascularization is performed, a stent is successfully placed in the left anterior descending artery, so LAD. Worsening shortness of breath. Ooh, fuck. Ventilation perfusion scan of the patient. This looks like gonna be decreased ventilation decrease at the right base. Oh, yeah, go ahead. Look, these are fun. For me, these are fun questions. I like doing active recall by doing questions. These are active using of my knowledge. Because if I don't use it, I lose it. Worsening shortness of breath. Oxygen. Oh, God. So if it's at the lung bases and blunting of the costophrenic angles bilaterally, this isn't going to be just a. This could be normal perfusion with bilateral ventilation defects, especially because he has shortness of breath. Yeah, I was right. This is the ventilation issue. So in shunt perfusion, basically what that means is there's decreased ventilation and a low VQ ratio, V and Q, so it's like ventilation equals 0. In normal, the V and Q is going to equal 1. That's the ratio because like there's ventilation and perfusion. When there's not enough perfusion going on but you still have good ventilation, then you're going to have shunt perfusion. Normally you're gonna want it to equal 1. In dead space ventilation, this means there's decreased perfusion and wasted ventilation with a high VQ ratio, and in lungs with no perfusion left, VQ is gonna equal infinity. Oi, wait, you're pre-med here in the Philippines? Do you want help on the PLE or not PLE? The fucking NMAT. I did pretty well even though like I didn't study much. Wait, pre-med, like, wait, what's your major? What's your undergrad? Anong undergrad mo? Ah! Oh my god. Wait, but legit, what undergrad are you doing? Like, don't tell me the school, don't tell me like the full details, but like, let me know. Are you doing like a regular degree or are you doing like those? Hey, okay. Hell yes. Hell yes. Awesome. I my two minors in undergrad were in bio and chem. My major was in psych because psych is very much needed in medicine later. While like low key, a lot of the biology stuff like ecology, etc., it's not really that needed. But biochem, orgo, oh my god, yes. Especially when you get into like where I am in YL2 for med, all of the biochem, all of the orgo, the acetylation, the fucking alkylation, the fucking nucleosidal attacks, it's all there. It's all still there. but they expect you to already know that part so that you know how like the chemistry works to do the effects that we need. Ah, I see. Look, it's fine. Honestly, I'm just gonna say this now. Depending on the program that you end up trying to get into, like, depending on the program that you were applying to for like the intermed thing, or like the thing from like some of the other big schools, like the green school, like their accelerated med program, no, don't you dare. No, don't do it. Don't fucking do it. Please, please, please. I'm begging you. No. I interact with a lot of those students a lot, and they're a pain in the ass to deal with, and they are very, no, no. You're saving yourself, legit. You're saving yourself. Ah, I see. Okay. Totally. Go, look. That UP is terrifying. I mean I didn't. I could have got I didn't apply because I was like, I don't want to do that's so hard. That's so hard. Like I just went to the school that I went to, that I'm at, and I like my school despite all of the flaws. Though honestly, if I knew that like St. Luke's had a med school, I would have applied there. Like dead ass, I would have just applied there because like at least I know the place. At least I know where that is. Like I know there. I have a car, that kind of thing. But like where I am, no. No, I didn't think to bring any of that shit. Well, what can I do? Oh no. Okay, though, fair. My god. Interviews are hard. Like, especially like if you're not used to yapping or like talking a lot about yourself or like making shit, not really making shit up on the fly, yeah, but like doing things like gassing yourself up. Like that shit's really hard to do, especially if you're not used to it. So people can easily fuck up interviews. I have done that before, but also I've had to like practice a lot for interviews because I was really trying to go to the States. Like that was my whole deal before I even thought to like before I resorted to going to the Philippines. Like Philippines was like my backup plan because it was also going to be cheaper. Like then go to a US school. Because that's where I'm born, like really. But damn, that's crazy. I mean, I'm not gonna ask like what school you want to get into. I'm just gonna tell you Grenberg's Handbook of NS. Ano yan? What's that? I'm gonna look at it. I'm gonna look it up now. What the hell is this? Ito. Oh, Handbook of Neurosurgery. Oh shit, this book. That's cool. I haven't yet, but I'll get there eventually. Though I'ma just say this now, I do not want to be a surgeon. I don't want to be a neurosurgeon. I am clumsy. I like talking to people too much. I don't want to be I do not have the ego that surgery or neurosurgery takes. Not at all. I just want to be I am. I just want to go home, like back to the States, and then just practice as I am. Maybe do family practice. Because, like, that just, I like that. I like that kind of life, surprisingly. Like, obviously, I'm going to be working in the hospital as well, but I really want to do, like, the old model system. Like, the old model where, like, I I have like my own private practice. I have a patient population that I take care of, like a big community, and then I round in the hospital on those patients in their in like the hospital they have to go to if they go. Yes, yeah. I am American. I was born in the States, but I am Filipino. Like, don't get it twisted. I am Filipino. It's my parents just never taught me Tagalog. So I struggle now. I struggle now. Wait, but wait. Like, wait. Is my accent really that distinctive? Like, this is just normal American accent. Huh? Oh, well. I mean, I guess it's distinctive here in the Philippines, but like I didn't really think about that. Like dead ass. I didn't think about that. Mm-hmm. Like I just really like talking. I love public speaking. Well, yeah. I do have a deeper voice. That's true. I I could put on like I could here's the thing. I can put on the anime like really high pitched like that voice. I don't want to. I do not want to. You're not going to make me unless like I make that into like a chat redeem goal for like a whole stream. Exactly. I don't want to do that because that hurts my throat. I don't want to that'll strain my vocal cords. Like this is my normal range. But I mean I definitely could, but I'm not doing that because then people's ears will bleed. So no. Okay, an investigator is studying patients with decompensated congestive heart failure. Ooh, hormone released from atrial as well as serial movements I mean, I can try. I can like pull up some like after this. I have like 8 questions left in this. Then yeah, we can. Okay. So right, most likely mechanism. So this is going to be positive. Ooh, atrial pressure and the serum level. So this is going to be constrict. Oh no. Oh, is this ANP? Shit, that I don't know this. Oh, it was this one the whole time. I was like, wait, is this decreasing sodium at the collecting tubules? Well, it's fine. Fucked it up. Okay, 1 pack of ciggies for the daily for the past 3 years, 30 years, and drinks a glass of wine daily. Hypoxemia in the patient. Oh wait, no. I didn't read this properly. Yeah, it was the SC elevations. This is an MI. Okay. X-ray of the chest is shown. Which of the following is the most likely cause of the patient's findings? Ooh, this is boot heart. This is boot heart. Boot-shaped heart. Boot-shaped heart, and like this maybe this I mean, is this boot-shaped heart? Cause like this if it's boot-shaped heart, then this is tetralogy of Fallot, but TOF, but I can't tell. This could also be just left ventricular failure. Oh yeah, no, this is left ventricular failure. Where are the Kersley B lines though? What? How are you supposed? Okay, you know what? I'm gonna send this over to Hika and I'll be like, dude, what the fuck am I supposed to be seeing in this? Because this just looks like a. Oh, this is a beautiful little thing called Amboss. The fuck am I supposed to see? Where the hell are the where the hell are the lines? Curly B lines. Yeah, this is a beautiful little thing called Amboss. Amboss. This is what this is. Basically, this is it has a big comprehensive library, 22,000 exam style questions and clinical and educator tools. I love this website. I love this source for the articles and shit because they're very useful for me, especially like if you I am a bad student. I'm gonna say that now. You can clip it. That's okay. That's fine. I am very bad at reading lecture materials before class, especially when like the lecture materials are really fucking shittily formatted. So like I use Amboss daily. I love Amboss. Ooh. Wait, normal pressure volume loop gray for comparison. But the pressure loop, oh, and light gray. Oh. So like cardiac cath. Left ventricular Yes, I also, here's the thing. I am bad at memorization. I could never do it. When I was younger, I was better at memorizing, but like, no. Even then, like, it took me so long to memorize, like, what other people could memorize in a day. It would take me like a week. It would take me like a fucking week. So obviously I could not sustain that. So, like, yeah. I do not like memorizing. I prefer to understand and then use the material, because then like I can't. Wait, what did you wonder about? Also, dude, if you have questions, like, I have a Discord too. Like, I finally made it. It's !DC. Please don't be weird. Like, there are other med student, like, some of my med student friends are in there. Don't be weird. I'm spectral, etc., etc. But also, like, there are a few doctors in there, and also, like, some of my other buddies, like, my other VTuber buddies in there, too. But, like, you know, like, that's... What was your question? Like, what were you wondering about? Following is normal likely cause. So this is going to be... So considering the fact that the pressure is really high but the volume is really low. Oh, yeah. No. So what a lot of people... this is when, like, things like space repetition, the thing that Anki, like, works with, like, the way that Anki cards work. Space repetition is poggers. Like, I'll pull up some of my Anki cards, too, like, after this, but, like, Anki is the best for, like, just trying to memorize things effectively. Oh, it works. Awesome. Like, here's an example. So, I'll pull up a card. Like, if I want to look at a bug. What tumor suppressor gene does the E6 protein from human papillomavirus bind to and inhibit? This is going to be P53. Because P53, both the E gene both E gene E6 product and E7 product inhibit TP53 and inhibit PRB. Basically, like I do shit like this in order to like try to like for the things I'm never gonna remember. Like, if I'm, for the things I don't understand and that I'm just gonna have to resort to memorizing, that's when I do shit like this. I do Anki. I do Anki, Amboss, and Sketchy. All of these three things have been helping me, like, stay afloat so far. I mean... Okay, so partially, yeah. You should remember that. But also, this is why this is why you cannot this is why you have to sleep. This is legitimately why you need sleep. Sleep is extremely important. Sleep is like one of the biggest things that will help you when you're in this when you're in this shit. When you're here, when you're in the thick of it, sleep. You need to sleep. Prioritize it. If there's shit that you cannot do anymore, if there's stuff that you just can't, like, if you're completely saturated with information, at this point you might as well just go to sleep. Because, like, it's not gonna be worth it. Legit. And I mean, partially also because, like, oh god, that's gonna start in like 15 seconds. So like the big CSF, like the cerebrospinal fluid, like flush that starts when you go to sleep. Yeah, that thing. Like that shit. The one where it's like, whoosh, there's a whole lot of like CSF fluid that basically flushes out all the toxins, all the beta accumulate, like the beta amyloid plaque accumulation in your brain whenever you're like, that just kind of happens. Yes, you need to prioritize sleep. Sleep is one of the most important things when you're in this fucking degree. I'm not joking. Sleep is extremely important. My model has eye bags because I did not value sleep, and I'm suffering for it. The eye bags are permanently on now, both in real life and on my fucking model. So, like, definitely just you cannot forget sleep. It is extremely important. I understand that, like, sleep deprived and having an irregular sleep pattern is kind of typical for undergrad, but I hate that it is. Because we need, like, so much sleep, especially when we're, like, trying to save up all this information. Like, partially the reason why it's really hard to memorize information is if you're, like, not asleep. Your fucking hippocampus, like, the process by which, like, your short-term and working memory get put into your long-term memory. Whoa! Oh, shit. What the fuck? What the hell? What? Somebody followed? What? Huh? What? Thank you. When the hell did that happen? I'm shook. Hello. I am very surprised that I have 120. Thank you. Legit. But for real, sleep. You need sleep. You need rest. You need to eat properly food. Yes, you are the 120th. Hello. Welcome. Also, welcome for your first time chat. I was shook. I was like, oh my god. The what's it called? The fucking alert noise, like, always jump scares me. Like, all the alerts jump scare me. So but yeah, but yes, hello, welcome in. I am doing congestive heart failure Q-Bank questions. I am a second year med student, VTuber, and constantly tired, and I wish I could get more sleep. I'm also, like, low-key addicted to this really, like, nerds right now, like the candy. The 7-Eleven near me, like, is stocking. No. Okay. Japun, here's the thing. I have done that before. So before I got into med school, I was already working in the hospital, like, as a medical assistant and as an ER scribe. So a lot of what I was doing, a lot of my time studying and all that shit, what I was doing, in addition to studying so I could, like, try to do another med school application cycle for the States, I was working in the hospital. And I would come back home so exhausted that sometimes I would sleep talk. And I would sometimes sleep talk shit like asking, like, clarifying orders, like, hey, why Hey, why are we getting an MRI on this patient? Don't we need a prior auth first? That kind of thing. Like, I would do shit like that. I was that sleep deprived. I love sleep. So no, it's not weird. Don't worry. It's not weird. Whatever helps you actually get to sleep, take it. Well, so I think this is going to be increased ventricular wall stiffness. Yeah, because it's a dysfunction. Because if you have decreased ventricular compliance, then even with the amount of pressure, your left ventricle isn't going to be able. Yes, it is. It is hilarious. It was just a consequence of working so much. And the funny thing is, even to now, I still miss working in the hospital. I love the hospital. I love hospital. I love working. I love working. I love it. I love working. I love interacting with patients. Like, I love the work of medicine. Legit, like, dead ass. I will, like, I could have stayed as a medical assistant and, like, eventually maybe get a CNA and then maybe do an LPN, like, in addition, like, while I was just waiting. But, like, I just, okay. I love the patients. Like, I loved my patient population. I love taking care of them. I like being able to, like, talk to them and hear their stories, that kind of thing. Wow, very altruistic of me. Wow. But no, that was really my reason. I love that part of medicine. Because I love the people. I love the people in medicine. Like, even if I complain about patients, I understand that, like, well, part of it's not really their fault. Oh my god, wait, Prussian blue stains purple? This is amyloidosis. Or no. Oh, is this Pappenheimer bodies? Because if it's Pappenheimer bodies, this is probably like some kind of anemia or something. I don't know. Oh, it's hemosiderin. Okay, so I was right. I just forgot, like, which one that is. So that it's probably, like, sideroblastic anemia. Okay. What are these cells? Oh, they're just called heart failure cells. I'm thinking of the other kind. Okay, well, now I know. Like, I mean, also, like, for me, I've had... Oh! 1 second. Give me a sec. 2 seconds. 2 seconds. I am going to... I feel like at this point I really should just have a drive as a part of my, like, a Google Drive in my Twitch of just, like, all of the books I use. Because, like, that'll be extremely helpful for you. Though, I am gonna say, before you get into med school, before you get into school, value your time away. But like the month before you get into get into school, like before your classes start, take that time to do all of the fun shit that you like doing. Like, use that time that you have to just have fun. Do like anything that isn't medicine for like a month, because you're not going to be able to do that again later. I can assure you. Like, that is extremely important. You need to... Okay, I'll find the books, because I'm going to drop them. So I feel like at that point it's kind of important. I also have to make sure I also have to clean up my fucking folders of books, because, like... Okay, that's fine. You like playing video games? You like doing any of the things like if you like working out, you're not going to be able to work. It's going to be like a pain in the ass to schedule working out and studying and the other things you like to do. Like when you are in med school. I will assure you of that. Oh, dude, 1 second. I'm literally just waiting for the books to upload to like this drive that I'm setting up. Or like I can just wait. I can just put them in my fucking Discord, can't I? I can just do that. Damn, wait a second. Yeah, like I can just I can literally put the book PDFs into my Discord. I am so smart. I'm smart. I am smart. And also, like, just do not ever buy the books in person. Or don't buy the books. Like, don't you dare. Don't you fucking dare buy the books. That's bad. You are not gonna... It's gonna be a waste of your fucking money if you do that, I promise you. Wheater's functional histology is also good. Yeah, no, like, I do have nitro, because, like, that is, like, the thing I do. I do that. I do that. I'm just, like, waiting for the books to upload to my Discord server. And also, I love Lippincott's biochemistry, but I hate Harper's. You're never gonna make me like Harper's Biochemistry. I hate that book. I can never read it. It is the worst book that I've ever read. It makes biochemistry boring. And like, this is coming from someone that loves biochemistry. Like, I love biochemistry. Like, dead ass. I enjoy biochem. Like, that was my best class. Yeah, of course. Join the Discord. Welcome to the bottom of an energy drink can, if you decide to join. Just do like !DC, that way you can like get an access to the Discord. Like, I'm like low key, I'm just slow. It's weird to say, but I hoard a lot of like files that people share to me. So like, yeah. I hoard a lot of like I hoard a lot of files. I hoard a lot of like videos, resources, like note systems, that kind of thing. Because like what if I need it? What if I need those files, you know? This is gonna be increased wedge pressure. This B. Ischemic cardiomyopathy. Oh, cool. So, like, here's the thing. I don't know what school, like, it depends on the school that you're aiming for, but, like, for me, wait to read, like, the specialized books. You gotta get the basics down, like, down pat. I am not joking. Get the basics down pat. Make it, love them, know them like you know your own name. Like basic pharmacology, basic biochemistry, basic physio, basic anatomy, which is just like everything of Netter's, that kind of thing. I also have I'm also uploading Netter's Atlas of Human Anatomy in there as well, because like everybody needs Netter's in their life. I love Netter's. It's honestly a beautiful textbook. Honestly, one of my favorite textbooks to ever like own or have. Dead ass. I just love I love it. It's so fun. I like studying when I make it fun. I don't like initial I just don't like regularly enjoy studying. Like I'm gonna say that now. Well, oh wait, if this is the case, then it's where is it? Oh, it was decreased on compliance. Oh well, because I was like, increased residual volume is gonna do that, but for the ventricular function is gonna be decreased on compliance. So yeah, yeah, exactly. So though honestly, this is me and this is bad. Don't be like me in some respects, but just because sometimes I get bored by reading the book unless I do something silly like read it out loud to like chat. But even then, when I do that, nobody's here. Just like try to enjoy your time in medicine, or at least do your best to like make it fun for you. Doing shit like this, like streaming my questions, being silly online, like annoys Saikin and Shiori and like all the other like medical other VTuber doctors and like there's other medical VTubers is my kind of fun. Exactly. See, it's fun. Also, wait, damn. Oh, pumpkin pie. You know what? That is like. Oh wait, we don't have Thanksgiving here in the Philippines. Fuck. That is something I just know. I just thought about it. Damn it, we don't have Thanksgiving here in the Philippines. I actually enjoy Thanksgiving food. I like dead ass enjoy Thanksgiving food. Weirdly enough. Oh shit. I see. I could never. I can't do engineering. I tried. Deadass. I still cherish it. I still miss I think I miss Thanksgiving food. They don't have Thanksgiving food here. I can't make it because I don't have a fancy oven. I don't have the oven. I don't have the oven I would use. All I got is salmon and broccoli. And also spinach. Like just frozen spinach. I don't even know if I can. You know what? I'll try. Maybe. I want to get a turkey. If I could get a turkey, like, I would. Ooh. Frothy sputum. It's gonna be transudation of plasma into the alveoli. This is an acute MI. This is an ACS. Yeah, fair. Oh, I like the New Year here, actually. I like the fireworks. I mean, so the Philippine New Year and Philippine Christmas is not new to me because like I would spend my time, like my family and we would come here like almost every year. We almost every year for Thanksgiving, for like Christmas and New Year's. We would like take 3 weeks off and then go here. Like I would go, like right after school ended, like we would go immediately, or like if I finished all of my like if the school schedule permitted it and I finished all of my exams early, then I would just go. Then we would just go. Like I would leave school early, and then we would travel like to the Philippines. It was fun. I enjoy it. Ooh, this is gonna increase. Oh no, wrong. Decrease physiologic dead space. I was not reading the question. But yeah, no. I actually don't know if they have turkeys here in the Philippines. I know we have like big pig. We have big pig. Though I know nothing about Turkey. Oh yeah, you can probably hear all the little dinghies in the background. That's me uploading the books to my Discord. Chest pain, shortness of breath, ET. Yep. No perfusion and no ventilation. This is the I mean, yeah. I mean, lechon manok is basically the same thing. But like, you know what? True. I do like lechon manok. Even though it is bad for me. I haven't gotten my labs done yet for this year. I'll get it done like during the break. I'll get my annual labs done at the end of December because I know I need to. That's like the best time to like be scared by big numbers so that I can then make my numbers less big by the next time December comes. Okay. Decrease out of abnormal non-compliance. Is this... No. I feel like this is just... Oh, no. Then this is... Wait. I don't know what this is. Is it literally a fucking rib fracture? Fine. It was day... I was thinking like, wait, what's gonna do that? Like, I wasn't paying attention. Because I was like, wait, decrease tidal volume. Yeah, all these are gonna do that. It was a normal lung compliance and the tachypnea that like hella threw me off here. Yeah, like this makes so much more sense. Because like if you have chest pain, if you have chest wall pain, obviously you're gonna have a rapid, shallow breathing pattern. Damn it. I am in medicine. Am I smart? I mean, I'm okay. Am I stupid? Absolutely. I am so dumb. I'm definitely a silly person that doesn't think. Duration of chloride influx? Ooh, this is probably like opioids. So... it might be this one. So, oh, it was A. Literally A. It was A or F for me. Okay, barbiturates, not opioids. Because, like, this would be opioids, would it not? Oh, no, this would be... Okay, never mind. Yeah, I didn't see the AA gradient. I see. Damn. No, it's not weird at all. Not at all. For me, at least. Granted, I am a weird person, so if what I do is normal, or if I consider what you're doing normal, maybe we're both weird. Because so I'm also just kind of numb to a lot of procedures. Like, when I would go to the hospital with like the doctor I worked with, like my boss, I would do a lot of it. I would do all of his documentation, and I would also get to go with him to the wound clinic. So I got to observe wound clinic patients, which meant a lot of wound care, which meant a lot of debridement and wound vacs and crazy, gnarly diabetic foot ulcers and decubitus ulcers and bed sores and or like I haven't seen any necrotizing fasciitis yet, or at least not in the States. One of our lecturers though here, she showed us a case of necrotizing fasciitis and also of like Fournier's gangrene. I've seen that before. Fournier's gangrene I have seen, but like the other stuff, no. I haven't seen necrotizing fasciitis like in person. I want to eventually, which is also why I want to do IM. I love wound care. I like wound care. I'm just like, eh. Yeah, this is a right to left Trump. So you're not weird. I can assure you. That or we're both weird. That's the most likely thing. We could easily both be weird. That's very likely. Sabihin niyo po ako it's okay. For real, it's fine. Do not make me read that in Tagalog though. I cannot pronounce that. Don't you dare. But yeah, no, promise you're okay. This is fun. Denver. Oh, so high EPO level, decrease O2 sat, increase lung volume. So wait, probably just E. It's like E or D. It was E. It was just benign polycythemia. Honestly, I'm surprised that like hematopoiesis isn't actually. Wait, no, he's probably working or like studying. Yes, it's because I cannot pronounce Tagalog words. I cannot pronounce them. It doesn't make sense. I cannot say that. There are so many words that I just fuck up pronouncing, so I just use a simpler version. So like instead of like the longer word for like do you smoke, like on like a social history, instead I just say magyoyosi kayo, like magyoyosi kayo po instead, because I cannot do it. It doesn't sound right. And like and like here's a funny thing, I try to say the Tagalog words to my patient. I try my hardest. They don't understand me because I'm so fucking bad at pronunciation. So they're just like, English na lang. And I'm like, yes, please, pwede? Can I speak English instead? Thank you. Yes, I cannot say it. I am not good at Tagalog. I'm not good at Tagalog. I was never taught. What the fuck do you want from me? I'm sorry. What do you want from me? Okay. Pulse is 98. Blood pressure is 103. 109.73. Oh, Chain Stokes. Wait, no, this is Chain Stokes. So what is this? Really? CHM will do that? Huh. Well, now I know. Oh god, I think my model froze. Sorry about that. Come on, model, please don't freeze. I'll cry. There we go. Like, I cannot speak Tagalog. I cannot speak Tagalog. It's so fucking hard for me. Like, I don't even think I'll be able to survive the fucking intern year that I have to do it, the fucking like year I have to do at PGH before I do my PLE, like here in the Philippines. I would not be able to. No, I could not. Nah. Nor. Oh, wait. Oh, no. Oh, segmental bronchi. I see. I mean, yeah, absolutely. I have to. What else can I do? I have to do my best, of course. Increase cardiac output. Slightly well, no, if it's moderate intensity, then it's probably going to be increased, normal. pH is decreased. So it's probably B. Healthy 21-year-old man undergoes physical fitness exam. Oh, right. You wanted me to do, like, neuro shit, right? Right. I'll do that. 2 seconds. I just remembered. Like... Yeah, no. Here's the thing. Like, our standardized or quote unquote standardized patients, they just like pull people off the street and they give us them as like their patient, as our patients. Honestly, our patients are the oldies. There's no voila. Yeah, no, like, I want to be able to, like, speak to our patients, though. That's the issue. Because this shit's hard. Legit. What the fuck? Wait, why is it not loading? But also... Wait. Like... We're talking about acetic acid and H2O2? Oh, acetone and peroxide, right? I mean, you're gonna get like a weird thingy. I mean, oh god. It's gonna like smell weird. That's what I remember. Like, that's the thing that makes like the weird plastics, right? The one that does the... Oh no, I'm thinking of styrofoam and acetone. Never mind. I mean, I haven't. Mainly because, like, my fun... Oh, that's cool. That's cool. Definitely be safe, though. You don't want to lose fingers. Okay, episode less than a minute. Okay, what do you... Okay. Alright, buddy, here's a neuro question. What's your diagnosis? Or what's your what finding is going to correlate with a patient's symptoms? Yeah, go ahead. If you need me to zoom in, I can. What are we thinking? You know what? While you're answering this, I'm gonna go get myself some water. I'll be right back. I return. I got water. See? Okay. I'm gonna click it. Oh, okay. Let's try that one again. I'm gonna let you figure it out. It's okay. No, you can try again. You can try again. It won't count as right. It won't count as correct, but that's okay. Tell me what you think. What are your thoughts? Because we see the nausea and we see that the room is spinning. And she gets out of bed, and these episodes last less than a minute, and they usually occur when she gets out of bed or suddenly moves her head. So what system are we looking at here? Dorsal column, a positive Romberg test will be like, this is gonna be, so dorsal column dysfunction is gonna lead to sensory ataxia, which can have vertigo, but this isn't that. Yeah, of course. Here are all the choices. F? Okay. Or is that E? Oh yeah, no, that's F. You can think it through. Come on. Come on. It's okay. Also, dude, you can swear. I don't give a shit. I swear in here all the time. My thought here is like, since this is like some ear fuck up bull thing, this could be like nystagmus. That's my thought. Yeah. The vertigo and nausea. Cause like this just looked like benign. This looked like the BPPV. Yeah, you're good. You're good. You're good. It's okay. It's okay. Yeah, like cause like we actually did this test in school, the Dix-Hallpike test. It's the Dix-Hallpike test. Basically, you're trying to get them. You get the patient started in an upright seated position, and then the patient's head is rapidly rotated 45 degrees to one side, and then they're reclined, and their head is extended below slightly at the end of the examination table. Because we're trying to see if this happens. I see. Look, you gotta expand your horizons. Not everything is just neuro. Cause like, this is just neuro. This is just plain neuro. This is just. Let's try another one. Sure, let's do it. I can see where you're going with this. I see where you're going with this. The issue is like the palmar grass reflex is in the hand. This shit's going on in the foot, so it's good. The issue is lower. Like this is gonna be like. Look, yeah. Here's the thing though. You don't have to study this just yet. Neuro stuff happens at the end of the year, depending on the school. Like, my neuro was done at the end of the semester. Like, the end of the second semester. And honestly, like, that end of the second semester, like, kicked my ass. I hate neuro. I hate neuro. I like renal-ish. I like infectious, and I like derm. And I also like internal medicine. Try this one. This one's a little easier. If you know your anatomy and you know your brain, if you know your brain like parts, you'll know this one. 1 second. I spilled something. I'm gonna go clean it up. You have to get my fucking broom. Try this one. Try this one. Come on, you got it. What do we think it is? Okay. Yes! What area specifically? Even though it says it right there, I want you to tell me. I want you to tell me the name of the area, even though it's on the screen. Because I know you know the area. Yes, yes. Because it's the Broca's aphasia. Because Broca's aphasia is the language production. Yes. Wernicke is the one where you get word salad. Wernicke loves word salad. Broca's language system broke. That's why it's Broca. Even, yes. Though, technically his understanding center, the Wernicke's is not broken. It's the Broca's only. Because Wernicke means they wouldn't be able to understand any language. Their language understanding, their language comprehension system would also be broken. Not just the production center. Like, if both were broken, that's very bad. But, like, Broca's is just the making of words. But you can understand the words. It's like how I can understand Tagalog. Like, it's okay. It's okay. Buddy, you're still an undergrad. Focus on, like, kicking ass in undergrad. That way you can kick ass in med school. Like, that's the real strat. That or, like, I mean, you're in biochem, right? I mean, you're in biochem, so, like, are you I don't know how, okay, so, real talk. I don't know how, like, undergrad works here in the Philippines. Are you able to, like, choose subjects that aren't, like, specifically tied to your major? Like, can you take classes for, like, a minor? Can you take, like, a minor in a can you take, like, a minor? Oh, wait, what? Why? What the fuck? That doesn't make sense. I would feel like I would think that's extremely helpful. Being able to do shit like that. Why can you not? That's weird. I don't like that. Because, like, no. Okay, what I mean is your major is in biochemistry, right? Are you able to take, like, anatomy and physiology classes in undergrad? Can you take those? Like, can you get a minor in, like, biochem, and, like, can you get a minor in biology? Or, like, yeah, that's what I mean. Like, cause, like, yeah, that's what I mean. I also don't like doing things that are not directly tied to what I want to do. But then again, like, public speech, ecology, like, all those things are also tangentially tied to what I want to do, and they're interesting as well. But, oh, God, I mean, okay, so, actually, real talk, you know what? Real talk. If we're talking about doing extracurriculars, the extracurriculars that I want you to do are the ones where you can end up getting clinical experience. Like, do you know anybody in your family that's a doctor? Do you know any, like, do you have, like, a tito or tita that's a doctor or, like, works in the hospital? Like that? Do you know anybody? Or, like, do you have a primary care doctor that you're, like, do you have a doctor? And you'd let them know, like, hey, I'm really interested in medicine. Could I, like, follow you around for, like, a day? Because that's what I did. Well, for me, it was a little different because, like, my dad is an anesthesiologist and my mom is derm. Oh, shit. Do you know of any, like, does your school have any, like, clubs that do, like, medical mission stuff? Or, like, volunteering for medicine? Because, like, that's where you're gonna really learn medicine. Obviously, you need background knowledge, but like the actual doing of medicine, the actual learning, for me, I learned the most when I was working. I am learning a lot in school, but like most of the high yield learning that has stuck with me came from interacting with patients. That's why like my highest grades right now in like med school are in the three minor subjects, the quote unquote minor subjects of surgery, IM, and family medicine, because of my work, because of the time that I spent working. Because for me, learning is I learn by doing. I learn by doing. I am very practical. I am very tactile. I love being able to do the thing so I can learn it better. That's really how it works for me. But like maybe look into those. I don't know. I really don't know I don't know like how it works here for that, but like look into it. Cuz like there are yeah, do that. Okay. Cuz like that's really helpful. Legit. I don't know this anymore. Oh, it's lower motor, then this is positive a bit. No, I don't know this. I don't know this. Nah, okay, here's the thing. So it's like I like helping people like figure out like, hey, how do you want to learn? What do you want to do? Because like for me that's interesting. I'm in medicine for the people. Like obviously partially the money as well, because like I don't want to have to sell my soul to a corporation to be able to like make a living, you know. Medicine is like the best bet for me. I also like I hate doing spreadsheets. I could never do a job where like all I do is do spreadsheets. And I was so glad Rico and Saiken and like all the other doctors are not in here saying, but you look at spreadsheets when you look at the flow chart or when you look at the flow sheets of your patients. And I'm like, I don't want to think about that. But like, you just gotta, I don't know, just like don't close yourself off to like anything within reason. Like, say yes to a lot of stuff. Learn stuff. It's important. It's fun. I'm not joking. Medicine is really fucking cool, but you have to make it fun. It is hard. It is hard. I'm gonna say that. It is legitimately a hard fucking field, but there is ways to make it fun. This is how I make it fun for me. By yapping. Okay, actually, I'm so confused. What the fuck is a professional fee? What the fuck is a professional fee? What is that? What is that? We don't have that in the States. I don't think we have that kind of shit in the States. Wait. What? What do you mean? Huh? I don't think we get paid like that. We usually... Oh, that's weird. I don't like that. Cause like, granted in the States it's a little weird as well. Cause like, yeah, no, we don't do that. We don't do that in the States. Granted, we get paid by the insurance, which is the patients pay for. And then, like, it's the hospital that negotiates for those prices, I think. So, I really don't know, honestly. All these systems where, like, the payment is like that is just weird. The compensation for physicians is strange to me. I don't understand how that works. Like there's different kinds of compensation models for physicians. So like depending on like the billing and that kind of shit, it really depends. But also like cuz like there's the straight salary model or like the minimum income guarantee plus or salary plus bonus and incentive, which is usually seen in like HMOs, academic settings, or like large corporate or physician-owned practices. I prefer the physician. I would prefer that because, and it's also the issue is like without the bonus component, like, it offers very little long-term financial incentive. Yes, it is. Yes, it is. I mean, so okay, it's not okay. So yes, taxes in the states are high, but it depends on like what income bracket you are or like how much you can get written off on your taxes, that kind of thing. I can't do any of that. I don't know how taxes work. All I know is that I pay for them every year. I just pay for them every year. I think. I think. I just let my dad's accountant handle that. I, I, I usually just go to Turbo. I usually just go to like an accountant, or I tried to use like my W-2 forms, which are like these forms that I get at the end of the year, like before tax season, where that shows me like how much I earned, how much I have to declare for income tax, and how much I can deduct, that kind of thing. That's what I use. Like that's what I use. But like other than that, I don't fucking know. I don't know. I don't know how money works. I don't know how money works. I know how like heart failure works. I know how LASIK works. I don't know money. Money can grow on trees for as much as I know. I know nothing. It's okay. I don't know anything about money. I know nothing. Ooh. Okay, so the dotted line in the graph. So the bottom line in the graph, so it's like just oh wait, no. This is the point of neutral pressure. So then it's just the functional residual capacity. Fuck, I clicked the wrong one. I was like, wait, fuck. Oh well. This is decreased lung compliance. I like none of them. I like none of them because I am very clumsy. I have cut myself with more than one tool on accident. The closest one that I am okay, the one that I am for the most part okay with is the needle driver, and that's it. I mean, I also like the toothy forceps. I like those. I'm very simple. I don't like. Yes, that's it. I cannot use any of the others. They scare me. I am not like Shiori. I am sorry. I don't want to unga bunga cut. I don't want to do that. I'm not good at that. I don't want to. I don't want to unga bunga cut. I am very simple. What Okay, wait. You didn't say okay. I like okay. I am biased now. You didn't mention cautery. I don't consider that. Wait. Oh, yeah. Cautery is a surgery tool, huh? Oh. So, okay. There is one cautery. Okay, there is one cautery thing I like. The cautery thing I like are these like portable cautery pens that my mom would use in derm. I'm gonna pull up a picture of them because I am very simple. I am very simple. This is what I like. I like these. I like the electro cautery. I like the electro cautery. I also like these. Wait. I'm putting the picture. I'm putting the picture. I like these. I like these. I like these. Yeah, I know the one that you're talking about. That's the machine. I like the cautery pen. Okay, that's cool. But like, I like the cautery pens. They're single use. They're simple. Yeah, no, I know those. I know those. I haven't worked with them, but I've seen it be done. But yeah, so, but yeah, nah, I like these. I also like, okay. There's another thing. This is very simple, but I also like the pens that you use to like do like nitrogenous freezing. Yes, yes, they are powered by AA batteries, and they suffice for portable use, outpatient or inpatient. At a pinch, you can use them anywhere. I also like the nitrogen pen, like the nitrogen freezing thingy. The nitro freeze pen. 1 second. This thingy. I like the cryo pen. I like the cryo pen. The cryo pen is fun. These are cool. I like these. Honestly, that's cool. I don't know anything about that. I don't know electrical engineering. I know nothing about electricity. Voila, I know nothing. My head when it's not used for medicine is empty. Yeah, I'm very simple. I like those. I know nothing else. I I don't I don't understand electricity. Okay, so granted, I do semi understand electricity. I had to for physics 101 and 102 because I had to take both physics 1 and 2 and like for like the MCAT. But yeah, nah. But yeah, so I don't know. That's what I like. I like medication. I like studying pharma. But I don't know. I'm very simple. If it's not something I know I need to know, I'm not gonna know it. Like this. Oh wait, I have to do this case now. Okay, I got a case. Okay, patient, 65-year-old married Filipino. Chief complaint dyspnea. Patient was apparently well until 1 month PTC, where she noticed having shortness of breath. Okay, this is CHF. This is like decompensated CHF. My part is to do the pharmacology questions now. So, what are the goals of therapy for this case? The goals of therapy are... Look, here's the thing. I get that. I get that a lot. I understand entirely. Me, honestly though, like, my undergrad was psychology. So, like, it all works out. It all, like, meshes together really well. I love psychology. I love psychiatry. Legit, I just like medicine. And I love psych. What do you mean? Like, for psychology? Versus psychiatry? So, psychiatry is, like, the specific study of, like, mental disorders and, like, that stuff and, like, all the treatments for them, whether they be pharmacological or therapy. Psychology is, like, the interesting shit. Like the Freud, like the theories of personality, the theories of motivation, like understanding why people do the things that they do, like through the use of culture, under like they're just like people. I like people. Yeah. So like you ever yeah. Yeah. I mean, so here's the cool part. It's all of it. Psychiatry and psychology are everything. Because like in psychiatry, you still have to use a lot of the stuff in psychology to get to the pathology of the patient. But yeah, so because it's like, granted, Lev is gonna like be a better person to ask about this because like she's literally a psychiatrist. But like, that's my understanding of it at least. And also just like I really like studying people. Really, I like studying people like inside and like outside, like in their brain and like the stuff in the body, plus like what they do as the people. So yeah. No. I mean, you could be hallucinating. You could be. You don't know that. I'm not gonna armchair. If you ever, cause like, I'm not gonna armchair. Buddy, go to sleep. My God. Go sleep. It's like 9 p.m. It's like 9 p.m. You can go to sleep now and then just wake up early so you can study longer. It's fine. Go sleep. But also before you go sleep, join the Discord so that you can get access to the books. Because they are on my Discord. All of them. or at least all the books that like I've been using it, all like the books from school are in the Discord. Well, okay. Don't treat them like specimens. Don't don't treat them like specimens. Cause like again, everybody's people. Well, yeah, fair. But it's sort of like I like learning about people. And psychology and psychiatry are just and like anatomy and like medicine's just a way to like get to understand people. That's my view of it. I like people. I like people. Well, yeah, of course. That's the fun part. And then like when you like start to apply when you start to apply like behavioral theories and like motivational theories and shit as to like why people could act the way that they're acting, it gets more interesting. It gets interesting. It's fun. Like legitimately, it's all fun and games. But yeah, I might as well answer this. Fuck, I keep getting so confused. Huh? No, 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 no. You're good. You're good. My my thing is you should probably not allow people to overstep your boundaries. Please. That's important. Overstep it like allowing people to overstep your boundaries will just lead you to getting hurt or burned out in the end and we don't want that. We don't want that. Nah, but no, for real, like, it's not trauma bonding, it's not trauma dumping, you're just explaining shit. I am here to yap. I don't care. So yeah, no, don't apologize, legit. I'm just chilling. Yeah. Well, I mean, yeah, of course. Obviously, I would have hoped that it wasn't why you needed to learn how to read people, but like, but yeah, okay. But yeah, one second. I gotta like at least try to work on this. One sec. Goals of therapy. So initial management for the case. So we're gonna want to get her. So my plan here is to get this patient on pressor or get this patient on like diuretics. We want to get as much fluid offload. No, no, buddy, you're good. You're good. It's okay. But like, don't apologize. Shit, you're a viewer. It's fine. It's okay. My God. My God. Okay, so like for this, it's gonna be the goals of therapy. Get as much fluid off the patient as possible. Where's my sticky note actually? goals for CHF treatment. We're gonna want to reduce stress, like reduce preload as much as possible, so that we can offload as much of the, we can get like reduce the preload so that there's less stress on the heart. That's an important one. Hi, Hika. Hi, Hika. I see you. But no, for real. Hika, help me. What the fuck? How do you see this? Did you see the thing I sent? The thing I added you in? I don't... Where the fuck am I supposed to see the fucking curly bee lines? Where are they? I don't see them. Where are the lines? Where's the curly bee lines? I don't see shit. Help me. How do... I don't know what the fuck... What the fuck are the landmarks I'm supposed to be looking for here? Because I don't see shit. No! He's a doctor! He's a radiology attending. He's cool. Yeah, nah, Hika's cool. He's a doctor. Yeah. So like I asked him for help a few times before. I can't see it. Like without the overlay, I can't see shit. I don't know. I don't know what I'm looking at anymore. I hate radiology. I want to be like you, Hika. I want to be like you one day, Hika. To just read these scans like nobody's business and then you're just good. Like, what the fuck? That's not me. That's not me. That ain't me. But okay, now back to this fucking case intake. So the CHF management goals, we're gonna look at this. What the, I can't read. Ah! My god. I'll just look at this and then... Management, here. Oh. Oh, thank you. Also, I hope they don't take his fucking job because he's too cool. Also, thank you so much because like literally like the overlay, it showed. It like tried to show me the fucking lines, but I didn't see shit. Legit, I couldn't see jack fucking diddly. Here's the thing though, I don't like Jeff, but here's the thing though. I don't like the use of AI. Like, I don't think LLMs should be used in medicine. I don't believe they should be used in medicine. I don't believe they should. I don't think generative AI should be used in medicine. Machine learning, like, algorithms for, like, scanning, like, where random like, machine learning things. And yes, I know, Amboss doesn't give good radiology images, and it's hard for me to see. Uh, and yeah, no. I wish Amboss gave us good radiology images because then I could actually learn from them more. Instead of like having to go to radiopedia, and then like having to deal with the ads and the and then like the not full access and like the lack of the continuing education courses, like blah. Okay, so the goals of therapy: diuretics. Honestly, I'm just gonna look at this table. RAS inhibs, beta blockers, SGLT2 inhibs, MRAs. But yeah, no, I just don't believe that they should ever be used. Like, I don't think they should be used in art. I don't think they should be used in, like, I don't think literally, nobody fucking asked for AI. Nope, rather, nobody asked for large language models. Nobody asked for generative AI bullshit. The only ones that want that thing, the only people that want that shit are the fucking tech executives that, like, oh, look at next big thing, give me money. Like, they're like, oh, look at next big thing. Give me your money. I want your money. You should make mine, and you should make my Nvidia stock go triple billion. We should make this stock go to the moon. You should give me money to make that happen. Do we care about the people that are going to be displaced if AI get popular? No, because number go up. That's what they want. That's what we all want. We want the money. And obviously we don't fucking want that. Also, I just want to clip. I want to test out this command. But no, legit, I hate AI. I'm never gonna like it. I'm never gonna use it. I've never used it. And I'm gonna continue being a fucking purist and never using that shit. Like, legit, I don't like it. I don't like it. No, like I could never. I could never use that shit. I will never do any cognitive offloading onto an AI because I need to maintain a cognitive load. Because if I don't use it, I lose it. I treat my learning like a muscle. So yeah, never, 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 never. Wait, what? Oh, okay. So the Da Vinci surgery system is fine because it's just like a fucking. I treat them like a fight stick. The surgical robots, they're basically just a fight stick or like a keyboard. You're still doing the thing. It's just a little faster. That's okay. Also, what do you mean? What do you mean who was an outpatient center at 3 a.m.? Oh wait, are we talking about this case? Because I would not be able to tell you as to why that is the case. Wait, where is it? I'm gonna go back to the pharma though. An outpatient center at 3 a.m.? Oh, so Jepang, the difference between in and outpatient. So inpatient means you're in the hospital. Outpatient means you're like at a clinic or like a doctor's office. Basically, you're not in a hospital. Any of the care that you get that's not in a hospital, that's outpatient. I think. I think. I might be wrong, but I'm pretty sure. Like, I'm pretty sure. Sure na sure. Oh, I'm eating nerds in the background. Oh god. I'm eating candy. Cause I got nerds. I am eating nerds. Because I love nerds. Wait. Oh, seriously? The ED is outpatient? I didn't know. I did not know that. No, ED as in emergency department. That's what we usually use. You know what? Fair. So, crazy. Crazy. But yeah, no, I'm eating nerds. Okay, well, okay. Granted, yes, I eat a lot of. I don't eat a lot of candy, but like it's a small. It's like a box. It's a box, and they have just a lot. Like I'm just eating these, and like they have a lot of like little tiny pieces of candy in them. So like it's kind of hard for me to not just kind of to. It's just a tiny. They're like tiny little nuggets of sugar, basically, with no artificial flavors. Yeah, they're delicious. I love them. I love nerds. They're like my favorite candy from when I was young up till now. They will never not be my favorite candy. Legit. I fucking love nerds. Hika, I think you're just Hika, let me guess. One doctor is a nephrologist and the other is a cardiologist. Honest, I mean, it sounds like it could be. Like, I just love nerds, though. Like, the candy is just good. Like, I will eat these forever if I... It, like, if I could get no... Like, I'm literally just... I decided to just fucking pour some out onto my desk so that at least it won't sound as bad. This is all I'm eating. But also, I think Hika could win against an AI. Hika absolutely could. Because at least radiologists are trained to run a code. A robot can never do a code. Yeah, exactly. Like, also, humans just learn. And also, unlike AI, humans don't need like a million tons of water in order to like function on a daily basis. Or like to do a single prompt. Humans don't need a million tons of water. AI, however, do. Hence, humans over AI any day. Never using that shit ever. Oh God, it's so crazy loud outside. My God. Yes, AI could never learn. Actually, learn. No. I'm just waiting for this bubble to pop, and I'm waiting for AI to just fizzle and die like the NFT. That's my true hope and dream. Hydralazine with isosorbide dinitrate and SGLT2 eyes. Non-pharmacologic measures. I mean, like I could never. AI with AI, it's on site. Could never. Yeah, that too. And you need high accuracy to do radiology. Also, like, a lot of these AIs, they're not really built to be, honest or actually tell you the right thing. They're really just built to like keep you staying on the platform longer and longer. Hence or like to do they have like a level of sycophancy that like not even doctors can do. What is dual use tech? Oh, yeah, no, exactly. Hika, I don't like bro, I gotta tell you. Oh God, that's scary. Don't worry, I was just stretching. Okay. Hika, I'm like high key scared for like my classmates. Like, a lot of them use AI. Like, some of them just use it to make QBank questions, which I don't like it. I don't like it. I don't like it. But I understand why they do it because they don't have access to things like Amboss or like Sketchy or the time to make their own questions. I understand that. But others just do what they're doing my assignments in AI. And I'm not going to I'm not going to fucking do that. So yeah, like if I were to put that shit if I were to put this assignment into A, yeah, of course, of course. Also, like I mean, I am older than you, so like I mean, like I don't know, something. People keep saying that I have wisdom or some shit, or that I am very helpful with like learning and like understanding things. I just like talking. And I mean, talking, people can find it useful. And you know what? That's awesome. If they find it useful, fuck yeah, go ahead. Yeah, same for mine right now, actually. Jeppin, you better go the fuck to bed. I bet you have class tomorrow. Because I also have class tomorrow. Thank you. I appreciate it, but for real, go the fuck to bed. How are you going to consolidate your memories into long-term knowledge if you don't go the fuck to bed? Go to sleep. Go to sleep. Go to sleep. Well, yeah, of course, Hika, you don't have school tomorrow. Because you're done with school. You're an actual fucking attending. Wow. Wow. That's so cool. And yeah, okay, fine. At 10, you go the fuck to bed. Well, yeah, you're not done with learning, but at least you're done with school. At least you're done with school. Look, do as I say, not as I do. uh, it could be ACE inhibitors or ARNIs. I prefer ARNIs. Well, Yay! I'm proud of you. I'm so proud. Legitimately, I am actually proud of you. Fuck yeah. Because here's the thing. The old school way of learning is how you get it into your long-term storage. You gotta actually do the thing to learn. It is extremely important. And also, like, there's some scary videos out there of, like, a lot of the scary things that AIs have done to people. Like, there's this video series, or this video by Kaylin Conrad, basically chronicling a few lawsuits that have been done, that have been, like, I don't know what the word is, but, like, that have been, like, put against, OpenAI, which, the lawsuits are about, death. Deaths that have happened due to, like, like, AI use. Obviously, the AI use is a big part, and then we have to think about the variable of these students, these people were, like, they became isolated. Yes. Okay, I don't like that. I don't like AI. It's fucking disgusting. AI is just kind of legitimately one of the grossest things I've ever, like, I don't like ChatGPT. I don't like a lot of these AI systems. Nobody is ever gonna make, no one will ever cause me to like them. Ever. And also, like, I thought they were, wait. I thought OpenAI was, like, trying to get government funding so that they could stay afloat because they were, like, quote unquote too big to fail, like the banks, even though they're not, and they should fail because they deserve it, because they deserve to. One second. I just want to get the, yeah, exactly, exactly. They are privately owned, which is another thing. I don't like it when private companies get. I know. Literally, honestly, Hika, I am very glad I just like shorted like all of my two Nvidia stock. I am very happy that I sold it now. I don't want it. I'm scared. I don't want it to go either too high or too low. Honestly, actually, no. I'd be okay if it went like really high and then I sold it then. But right now, no. God. No. No, I sold it now already. I sold it. Wait, I sold it? What? No, I sold my AI. No, yeah. I sold my stock in Nvidia already. I also got like a 200% increase. So it's not too bad. I am not touching my stock portfolio right now. I'm not touching it. No. I'm too scared. Like, have you seen the year to date? That shit's terrifying right now. Like, it was like super high at the start of the year. Then it like basically plummeted because of like the Trump bullshit. And now it's like slowly going up, but now it's going back down and it's freaking me out. Like, what the fuck? What the fuck are we supposed to do? Legitimately, this shit scares me. This shit's like actually terrifying. Now I only have three things that I'm invested in, which are VOO, Rocket Lab, and Novavax. This is not financial advice. This is not endorsement. I'm just saying what I'm invested in because I like talking about things. Disclaimer. Yeah. I mean, I do. Okay. So I kind of procrastinated on like writing my schedule for today, like my schedule for this week because I was tired. Sorry. I don't know. I am not perfect. I am not a perfect human being. Actually, wait. No, I lied. I think I still have my schedule. Do I have my schedule? Wait. I think I have it. Did I accidentally make my schedule ahead of time? Yes, I did. No, I didn't. I lied. I have to make mine today. I don't wanna, but I'll do it because I know I have to. No, never. That could never be me. No. Disclaimer. I am not endorsing or endorsing any financial advice. I am not a financial expert. I am not even a doctor yet. I will not give medical advice. I will tell you to go to your fucking doctor instead. I will tell you to like maybe go to an actual investment person because no self-help courses. The only self-help is, motherfucker, get off those AI bullshit apps. Get off those apps. Open a fucking book. Get off those apps. Open a fucking book and read. That's the best way for self-help. Touch some fucking grass. The best self-help you'll need. The best self-help advice is to touch grass. And also, like, get in touch with your community and, try to respect your common person. Remember that like even if people are inconvenient to you or like you piss them off or they piss you off, just remember they're people and remember their humanity. But absolutely no financial advice. No financial advice. Go to an investment professional. I do not. No. That's scary. For RAS inhibition with patients with ACH. Oh, these are reduced ejection fraction. Okay. Good. I am glad that you touch grass. But yeah, he got. You are okay, buddy. Legit. This is fun. I am just gonna open this tab to a new window because, like, I keep looking at it and I might as well just have this open on another window. Actually, wait, Hika. Can you do me a favor and, like, access this article for me? And send it in the Discord? Please? Please? I'll send the link in here. I can't seem to access it even when I log into my institutional account. It's this article. I can't get it. That's a question for him because I actually don't know. Okay, I can't get this article. What? Wait. If you can open it, maybe I can just download it. Never mind, Hika. I think I got it. Oh yeah, I got it. Never mind. You guys are awesome. I didn't realize it because, like, it wouldn't let me. It, like, kind of fucked up on loading, so I assumed that, like, maybe it just wouldn't work. But I got it. Thank you. Honestly, though, it also, like, not gonna lie, it would be kind of fucked up if they put behind, like, the expert consensus decision pathway for treatment of heart failure with reduced ejection fraction behind a paywall. Because, like, huh? Why would you put, why would you put, you know, care guidelines behind a paywall? We need those. We need those so we can stay up to date. TMCR. Up to date. You know, the app. I'm joking. Honestly, I feel like I didn't have to even put the classes. I think I can just put the goals of therapy. So, goals of therapy. So, goal 1. Oh, so, basically, so my name's Spectral Anomaly. This is because I was a big fan of ghosts back when I was like really obsessed with ghosts. Like, I don't fucking know when. When did I even make? You know what? The better answer would be to check how, like, when did I make my Twitch? Like, I'll like figure that out right the fuck now. Because like there was a time where I was like super obsessed with like true crime and like how ghosts work, and like I was really trying. Like, there was a time where I wanted to like do paranormal ghost hunting. And I was like, maybe Spectral Anomaly, that's basically like a spectral anomaly. So like a ghost, right? So basically, I thought that would be a really cool name, especially if I wanted to like eventually go and do like ghost adventures. I didn't end up wanting to do ghost adventures because like an EMF reader is like super expensive and I didn't know that. But I mean, it was still a very good thing to do. It's still a very fun name. Actually, Japang, Hike is the best person to ask these questions to. He was biomedical engineering. What? Oh shit. Oh god, why is it playing the sound? Fuck. Sorry, that was spooky. Oh, damn. You're cool. That's cool. Okay. Cool. I don't know what that is. Oh, that's cool. Here's the thing. I know nothing about MRI machines. if I have questions on MRIs, I'm just gonna mention Hika on a Discord message in my server or in Syken server, or just DM him at this point, being like, hey, I know your body radiology. Can you help me? How do MRI work? Cause I don't know how MRI work. I I offload. That's what I offload to other people. I offload to specialists or experts because they can teach me better than like I could ever like understand on my own. Buddy, you know, hey, at least you know how they work. I don't. I know how to order one, and I know like what happens when I order one. I get the result, and then we get a result, and then Hika or another radiologist reads it and then tells me the result. Then I look at the X-ray or the thingy, and then I'm like, okay, I agree with their results. I don't know why I'm reading it again, but I'm gonna read it just to make sure so I understand. This is the Unga Bunga. This is my Unga Bunga. Unga Bunga, send order to radiology. Unga Bunga, get order, get result back. Make make uh make patient care changes based on that, while doing like stepwise algorithms when it goes to like CHF and other bullshit. Like that's what I'm good at. I'm good at like that part. Don't ask me about surgery. Don't ask me about radiology. I cannot do that. Not yet, at least. I could never. I could never. Beta blocker. Uh, I don't. Uh, I don't know what any of those words mean. Fuck. I'm just a tuber. I am just a little anime character. I don't know what the fuck that means. I don't know what the fuck. When it's not like what I'm good at, I know nothing. Ask me about psychology. At least that I can kind of explain. What is War Machine? Oh. Oh, right. I don't need it for the steps? Amazing. Then I don't care. Uh, I'm okay. I'm glad you guys know. I'm glad you guys know. I never got that far. I could never. I legitimately could never. I could never. Smoking cessation. I know nothing here. I'm just vibing. I'm just vibing and doing my homework at this point because I know nothing. Oh god, a 2D echo was on yield the following results? Fucking hell, I don't want to do this. With systolic and diastolic dysfunction? Ugh. I'll do it. I'll read the guidelines. So it's just current. The cathode filaments get super hot, making it release electrons. The electrons move to the anode with the voltage difference. And when the electrons smack into the anode, they knock into the... Oh. Ah. Look, hey, at least y'all know what you're talking about. I cannot contribute to the conversation. Glad y'all are having fun. Initial management of the case. I feel like that's gonna be... Why is there an extra space? I don't like this. Why is there an extra space? What the fuck? What the fuck? Oh my god. Speaking of cardiology, a cardiologist is now following me on Twitter. This is crazy. Crazy. How are you going to addicted if it's a leopard? Wait, you can do that? You can do that to the X-ray machine? Well, I don't know. That just sounds cool. Beta 1 receptor activation. I feel like I'm right. Crazy. I don't know anything about that. Oh, no. If a magnet is ionizing air, it produces radiation. X-rays can also dislodge electrons from an atom's orbit by giving electron a lot of energy. Hence, I've got. Oh, that's why it's called ionizing radiation! What the fuck was that? That's why it's called that. Oh, cool. Fuck it. I'm bored now. I, did a lot. I, read a lot of stuff, but offline. And then stuff online. So, you know what? I'm gonna play a video game on stream. I'm gonna play a video game where I make make terrible omelettes. Give me 2 hot seconds to open up this video game. Once I figure out where the music is coming from. Which tab has the music? What the hell? Where's the music tab? It's somewhere in here. Where is my music tab? Where's the music tab? 1 second. I know what I'm doing. I am a streamer. Am I good at it? Fuck no. There we go. Found it. Finally. I'm gonna switch the topic over to, yep. You good? Look, it's okay. I'm not sleeping yet because 1 minute. That is a-okay, buddy. Am I gonna be mad? No. Come on, game. There we go. Stupid omelet game. It's not stupid. It's a very fun game. I have to make myself tiny, though. Wait, other way. Other way. Where's my tiny button? There we are. I've been, like, trying to win this weekly run, like, for the past week. I'm gonna move the chat over here. Like, probably just right on top, right there. Right there should be good. I should also make the music a little louder. I hope my topic is now an omelette you cook. I am making a terrible omelet. I don't know. Something about this game as just a fun little stupid roguelike is just so satisfying. Oh! Yeah, it's just homosexuality. That's all it is. That's the term. It's no longer a mental illness, but it's just homosexuality. That's all it is. It's just an alternate it's just another sexual attraction. That's it. It's just another sexual orientation. Right there, that's the word. Yeah. Oh god. Fuck. I mean, I don't know what other term it could be, but like, I know that. I know the term that I know. That's all. You know what? Fuck it. I'm gonna not show the chat because it's really hard to see. Why is it not? Oh, this needs to be edited. I need to change the title. Terrible. Okay, I saved it. I saved the changes to the live. Amazing. Come on. Okay, cool. Perfect. Bum 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 ba dum ba dum bum ba 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 da ba da ba 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 da ba da ba 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 ba. So, like, no. there isn't really like a term for being random for peers. You're just kind of spontaneous, but like there's no like specific term. It's not like you have a diagnosis or anything. You just have some variations in behavior, and that's just all it is. Hmm. But yeah, nah. Like, some stuff does have terms, some other stuff doesn't. Like, normal human behavior. That is all I would, like, classify it as, honestly. Ooh, I should get that. That would be my next item. Oh god, the fucking moldy one. Hate this motherfucker. Oh well. He follows the reverse 5-second rule. He wants the moldy things, but then I get points off for shit being moldy. So like, why do you want the moldy things, you very confusing dude. This game is basically just omelet making Balatro. This is just Balatro all over again. Which is... I like Balatro. I like Balatro. I'm not very good at it, but I still enjoy it. Hika, it's crazy how you still know that, because I don't know that. What the fuck? Granted, you are the attending and I'm not. So, you know what? Hell yeah, dude. I'm glad you understand this shit, because I could never. What? Is this spicy or no? Ooh, dry aged salami. Are we talking dry aged salami? Okay, dry aged salami. Love that. Yeah. Like, I don't know what it is, but like, it seems like basically all physicians love to teach. Granted, I also like teaching, so you know what? This is the best field to be in. No. No, absolutely not. I do not like it. Here's the thing. I've learned this. I hate it when lectures have just dead air. When everybody's just quiet. Cause like that's no fun. I like it when people ask me questions, cause then like either A, I don't know the answer, and then it encourages people to find out the answer. Or B, it's a way to learn. Like, here's the thing. If like there's no conversation, learning for me, I believe a lot of it is a conversation, because you get to learn what you don't know. Yeah, no, I love talking. Also, same. Here's the thing. People also don't like it when I talk in class. Who cares? You're the one getting the answer. You're the one getting the knowledge. So it really shouldn't fucking matter. That is my opinion. But like, I mean, like, cause here's the thing. What are you gonna do? Being quiet in class just means, okay, class is done. You're not getting your money's worth. It's because, like, college isn't free. College is expensive. College is fucking expensive. The best thing for us to do is to use, like, to do what we can to get as much knowledge as we can out of our lectures. Which means ask as many questions as we want. That is my opinion, and that is also my belief. I think talking is good. Also, like, I don't like it when things are quiet. It freaks me out. It freaks me out. I don't like it. Freaks me. Like, I hate it when things are quiet. I love talking. I love it when people talk. I love the back and forth. That's fun. That's fun. If people get on you for being like that, yeah, exactly. That's the fun shit. Like, if they find you annoying, okay. Go cry about it then. Like, they should go cry about it, not you. Don't change your thing. Well, okay. Don't be disruptive, though. Sometimes, like, if I blurt out too much, it can get a little bit annoying. And okay, I own it. That's fine. It happens. And that's happened to me before. What? Who cares about being a show-off? My God, you're there to learn. You're there for lecture. What the fuck? What do you mean? I hate that. I hate that worldview. That worldview can go the fuck to hell. I'm sorry. I am very much against that I'm very much against that. I am very much against, like, all of that. No. Who cares if who cares about showing off? You're doing it to learn. You're doing it to learn. Like, what? What? Oh my God. Like, that's just my opinion, honestly. Like, because, like, here's the thing. If they don't know this, then it means... Because, like, if they don't know this information and it's important, then at least now you know the information. Oh my God. Are you kidding me? 1 point away, I'm gonna cry. How dare. Nope. Let me out. No. So ions the sun afterwards the conference. I mean, here's the thing. Is it the professors telling you that you're disruptive, or is it your classmates? Is it your professors telling you that, or is it your classmates? If it's your classmates, fuck them. I don't care. Where did this diamond come from? But if it's the professors, okay, fine. Listen to them. Okay. My question for you is, who's paying for your tuition? Is it them? Who's grading your assignments? Is it your classmates? Is it them? If it's them, listen to their opinion. Exactly. They don't fucking matter. They don't matter. If you have to talk in order to learn and you want to ask questions, do it. Do it. Who cares? What are they gonna fucking do? What? Are they gonna get mad at you? Okay. As if they're not gonna do that anyway? Who cares? Who cares what they say? That's my advice. Crazy. I did not realize I would get that many points off of rock salt, though. What the fuck? Crazy. But yeah, no, legit. If they pay for your tuition, or if they handle your education, if there's a conduct grade and they're the one that grades you on it, then okay, quiet down. Unless they do that. Okay, you know what? Fair. I learned about the gossip culture here. People gossip about me too. I don't care. I'm older than them. Like, motherfucker, these are people that basically just finished. They didn't even finish. They just finished their undergrad. Because they're like the accelerated. They're like accelerated med. And you know, and here's the thing, you know that this kind of culture is not good for anybody's learning. Who cares? If they don't like it, it doesn't fucking matter. It's like, oh, they don't like it that you're trying to get the most out of your tuition, that you're trying to get as much out of the school because you paid for it. Okay. Okay, then okay. What? Is there a grade on their feelings? If there's a grade on their feelings, okay. There's no grade on their feelings, though. You know what the grade is? You know where the grades are? On your exams. On your quizzes. Exactly. Fuck them. Just do the good work that you do. In addition to being you. Who cares? Who cares? Who cares? Who cares? Again, they're not paying for your tuition. They're not the ones doing your schooling. It's you. Shit, I got the wrong item there. Shouldn't have gambled. Oh well. But yeah, no, legit, like... I don't understand. I mean, also, like... Because, like, it's not like... And besides, also, if they bully you... Obviously, this is like the nuclear option, but you can always just report it to your you can always report it to your dean, and then get their scholarships removed. This is the nuclear option, though. The last resort. This is the last resort. This is not the first thing that you do. This is the thing that you do after, like, everything else has failed. Exactly. Do what you want. It's your tuition. It's your GPA. Are you ruining their GPA? Hindi. No. You're not fucking with their GPA at all. Hence, it doesn't fucking matter. Like, I mean, people said the same thing about me back in Wild 1, and I'm in Wild 2 now. And a lot of the people that said that shit about me back in Wild 1, they had to transfer out into a different program because they were advanced. They were in, like, the advanced course. And if you fail in medicine in the advanced course, then you have to pick another major. And if you want to go back, and you can't go back to the same med school afterwards, karma's a bitch. Karma's a bitch. Ah, ba, 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 bum. Buddy, you're nicer than me. I can tell you that much. I don't let my feelings stay hidden when I'm around people that are very shitty to me. Obviously, don't be openly hostile unless like you really are prepared to be like that. Cause it's not great. And that will actually alienate people, but I do it. At this point, what else can I do? For me, it's either do or it's like a catch-22. Either I act the way that I do in class, and I do well, and they still don't like me, or I don't do that, and I don't be active, and I don't be helpful, and they still don't like me. Nope, no, I'm not. I am not from Texas. I am from the Midwest. You know what? I think I want that. Yeah, I think I want that item, and then I can just get something else here. Oh, yeah. Nah, I'm from the Midwest. That is where I'm from. I am like, if you look at the states, I am in the middle. Will I tell you exactly where? No. I will tell you that much. Oh shit. No! Fuck! My... Oh god. Oh god. Oh god. I may have fucked up. Oh no, now they're movable. Fuck. Oh no. Let's redo that level. That's the most I'll tell you, buddy. I will tell you I'm from the Midwest. That's it. Thank you. I appreciate it. Like, I will tell about my experiences in America, but that's like it in terms of like my personal life. And like I'll tell you happily about like my experiences in med school and like my undergrad. Will I tell you where? No. That ain't gonna happen. Yeah. All good, buddy. Ooh, now that I have a bigger canvas to work on, I can get more fucked up items for my omelet. Yes. I'm gonna get a veggie in here. Ooh, wait. Actually, the cabbage would be pog right now. Okay, I am bookmarking that item. I am gonna sell a cabbage. Buy me, sell me. Buying this. Get in some cheese. And I'm gonna get that fucking spicy crate. Yeah. Yeah. But yeah, no, legit. Like, oh, so, okay. So basically, the reason why antidepressants are called antidepressants, I'll explain in a second. So, like, the reason why antidepressants are, like, called that, honestly, I hope I'm doing it justice, because, like, Leb is the one that really I go to for this. Because, like, basically, the way that antidepressants work, there are different classes of antidepressants, but antidepressants are called that because they're mainly used to, because they're mainly used to treat, like, major depressive disorder, but they're also indicated for, like, other different neuropsychiatric conditions, like, so, like, but, like, because antidepressants, there are different kinds of antidepressants that have multiple, like, different mechanisms of action. So there's selective serotonin reuptake inhibitors, or SSRIs, and these are the ones that inhibit the reuptake of serotonin in the synaptic cleft, which leads to increased serotonin levels. These are going to be like fluoxetine, paroxetine, sertraline, citalopram, escitalopram, and fluvoxamine. And those are indicated for major depression or major depressive disorder, generalized anxiety, post-traumatic stress disorder, panic disorder, also binge eating disorder, bulimia nervosa, social anxiety, gambling disorder, somatic symptom disorder, and irritable bowel syndrome. The side effects are like usually headache, nausea, and vomiting, and also like activation effects of like agitation, anxiety, and nausea. There's also serotonin, norepinephrine reuptake inhibitors, which inhibit serotonin and norepinephrine reuptake in synaptic clefts. So that's like your venlafaxine, duloxetine, desvenlafaxine, milnacipran. There's also like monoamine oxidase inhibitors, and there's also serotonin agonists and reuptake inhibitors. There's also tricyclic antidepressants. There are so many kinds, but basically they're all used to like treat. I mean, yeah, they're basically used to treat like different kinds of depression, basically. Oh God. Like multiple things. Like they can be used to treat multiple things, but like mainly depression. Mainly major depressive disorder, which is like the official term for what we usually think of as depression. I hope I'm able to help. Oh my god, I definitely need to get more items on my board. Fucking hell. I mean, it helps. I mean, that's also why I like talking to people and asking questions. Like, it's just fun for me. Like, I just love talking. And this is just an excuse for me to just continue talking. Like, it's great. I love I like it. I love yapping. I love talking. It's one of my favorite things to do. Look, you're gonna be like that. And that's when Anki gets on board. That's when you start using Anki. Because I prefer Anki for like my space repetition. And also, thankfully, there are people on Reddit that make like Anki decks for free. So I just use those. I just read those constantly. I don't make my own cards because fuck no, I'm so tired. I'm so tired like most of the days. I'm not gonna be doing that. That ain't my circus, not my monkeys. Nor, not, never. Absolutely not. Are you kidding me? I need to get rid of one fucking trash bag. God damn it. Ooh, okay, I want this. Yes, gold. Gold leaf. Gold leaf on my items. Beautiful. Perfect. Nah, you're good, buddy. Do not worry about being annoying. I promise you are good. Besides, if I get annoyed at just anybody asking me random fucking questions, why would I be doing a Twitch stream? I know. Like, that would be like so fucking counterproductive. Like, what? That'd be so weird. Weird, yeah. Shit. Hi. Look. Yes. Perfect. Okay, Pika. Fair point. But my god, damn. I'm just waiting for this to like cook a little longer. There we go. Please cook longer. And go. Like, I like talking. If I didn't enjoy this, then I wouldn't be doing it for so long. Since like fucking April or some shit. I don't know how long I've been doing this, but I've enjoyed it ever since. Like, oh, so basically like the whole concept of like doing things that people find painful for fun. Some people can construe like Twitch streaming or like talking to people on the internet for long periods of time, aka Twitch streaming, as like a form of masochism. But also, we're in the fucking field of Hika. You can't say shit about masochism. You're also on Twitter. You're also on Twitter. We're both on Twitter. We're in the fucking clown car together. We're in medicine. We are the clown car. We have been in the clown car. We cannot leave the clown car. Something, we were born into it, molded by it. Or something. I'm never doing that voice again. I'm never doing that again. Okay, wait. Wait a sec. Finally, I can get rid of the trash bag. Beautiful. Wait, really? 2 months? Dude. It took... You pay for Twitter, though. Okay. Oh, I don't call it X because X is a lame fucking name. X is a lame fucking name and nobody will tell me otherwise. No one can tell me otherwise. It's a stupid fucking name and I don't like it. That's why. I don't like it. It just... Like, Twitter, I grew... Oh god, I'm revealing my age. Well, it's like, I know it as... I've always known it as Twitter. I don't want to change. I don't want to have to change, you know? I don't want to. You're not making me. No one will ever make me change. Oh god. What the fuck? Slowly extricate the items from the omelette. I am slowly extricating the items off of the omelette so that it is no longer on my omelette. Oh my god. Ah, I see. I use Twitter a little bit. It's even in my socials. If you do !point socials, you can find me there. Yes, I am in the clown car. I have never left the clown car. Twitter is my clown car hell. Oh yeah, that's the Discord. But yeah, join the Discord. So a clown car, I literally mean a car full of clowns. So like a literal car, you know, full of like the fucking, like the Ronald McDonald clown. Like, or like just a car full of clowns, basically. And we are all the clowns in the clown car because we are fools on the social media. I say this jokingly, don't worry. I say silly shit for fun. Ooh, I should use this item. Yes. Processed ingredients. Yes, finally I can get rid of a trash bag. Times one? Oh yeah, no, I have to get that item immediately. I can get that. I can get rid of that. I want that right now. Yes. Yes, exactly. Thank you, Hika. Thank you for backing me up. I got distracted. But yeah, basically associated with the sight of seeing like 10 clowns casually coming out of one tiny car. Twitter is the tiny car, and we are all the clowns in the clown car. Hika. Wait, what? Is a link invalid? One sec, I'll get you a new one. I thought I made a new link. I am so sorry. I didn't Oh, it expired. Here you go. Here's the new link. I did not know it was invalid. I am so sorry. I am so sorry. I am generating a new link so that can be the link to be used for the command. Damn, thank you. Thank you for letting me know. Ba ba da ba da, ba 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 da ba da ba da, ba ba da ba da, ba ba da ba. There we go. I edited the link. Awesome. But yeah, welcome in. Okay, what was I doing? Right, getting this on the board. Hi, Martin. How you doing? Oh, basically it's a joke. The bottom of the like energy drink can, because basically it's a reference to like being at the bottom of a bottom of a bottle. Basically, like it's a metaphor. Like you drank the entire can of energy drink, and all that's left is the empty can staring back at you. I'm doing pretty good. I was studying. Now I'm yapping. I'm playing a silly little game before I have class tomorrow morning. The fuck? There's a Christmas party in my fucking dorm. There's a what the hell? What am I on? There's a function hall now? That's what that new room was. Interesting. But yeah, that's the whole. Oh god damn it. I'm so sad. Actually, you know what? This is working out really well. Never fucking mind. Let's go. But yeah, basically it's the whole thing of you look at the bot when you drink a whole can of energy drink, and all that's left staring back at you is the empty can. That's the joke. It's funny to me. But yeah, I don't know. I'm doing pretty good. I'm just playing some video games for a little bit. Because I have been doing well. I have been studying. You know, I deserve a little video game as a treat. As you know. Because video games are fun. I don't know where this voice is coming from. Don't ask me. I don't know where that accent came from. I don't know. But yeah, that's the tea. Oh, I can just rotate it instead. This is amazing. Funsapa. Yes, they are massive books. They are big books. Well, that's what they're for. I mean, med school is very book heavy. What did you expect? And here's the thing: there's always more books. That's the problem. Ah, damn. You know what? I can sell that. Oh, are these underlappers? Underlappler? Okay. Yeah. Yeah, nah. Like, I mean, here's the thing. Your textbooks in undergrad are probably also extremely expensive. Am I right? Am I right? It's to be expected, unfortunately. This is really just how it is. I wish it weren't the case, but man, it's medicine. Though again, the most important thing is to do well in undergrad. I do not care if you are already doing well in undergrad right now. You can always do at least a teensy bit better. Because that will make sure your spot in med school is basically certain. Sorry, I'm just like, I was like locking in for a second so that I could properly place this piece of sausage. Yes, yes. Nah, Junker is huge. Junker is fucking big. Be careful. It's a big fucking bug. There we go. Come on. Nice. But yeah, no, like a lot of these, I mean, also like the basic sciences are thick as fuck for a reason. A lot of these books have to be big so that it gets all of the information. It like has to be that way. That's the T. Oh god, I do not want that item at all. I don't want to sell any of these off. I need these. You know what? I can sell off a bacon. I can, you know what? I have to just supplant it with another fucking item that works better. That one, that'll work. Reroll. That one, and that one again. Okay. The what? The O plus download? Wait. One sec. Let me check the file that I sent in there. What is an O plus download? I was like, I mean, they're all just books. One second. Let me look. Which one is that? I was like, they're all PDFs, unless there's one that isn't. Oh, I know why now. It's because they never uploaded properly. Let me see. What book are you talking about that has the, which book is the O plus? Oh god. One second. Let me just delete all this then. I'll delete them because I didn't realize they were like that. Because like they should just be the PDFs. That's so weird. Thank you so much for catching that. Snows and weeders. I'll just drop these and hopefully they're gonna be PDFs this time. Oh, my files are too powerful, that's why. Clinical Atlas. Jinkara. Okay, which means I cannot give you weeders, and now weeders like functional histology. Jinkara is good enough. They should be PDFs now. Oh. I didn't realize they were that big. I am so sorry. The books are even bigger. Let me just say that now. They should be big. They should be PDFs now. Yeah, they should be PDFs now. You should check on the ones that delete the ones that you just downloaded and try like one of them. Make sure that it's a PDF because it should be a PDF instead now. But yeah, it should be better now. I hope. I hope at least. Oh God. Oh Lord. Oh no. Oof, I know this. I know this omelet is scuffed. Ooh, I know this omelet is so scuffed. Oh, this omelet is hell. This omelet is gnarly. Oh no. I have fucked up the omelet. I have fucked up the omelet. Ah. Unless actually. Ayo. Wait. Oh God. Wait. Maybe there's hope for this omelet. Oh no, there's no hope for this omelet. I'm cooked. I'm so cooked. Fine. 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 Quick restart. Oh boy. That's true. That's true. You know what? You're right. You're right. They don't care. They don't have to care. Children are. It's just what children do. You're so right. Legitimately. Boom, boom. Okay, let's hope I get something. Ooh, yes. Yes. Ooh, there's some hope here. There's some hope here. It's cooking. I'm cooking. I'm cooking. I'm in hell. I'm in hell. I'm in hell. I'm in hell. I hate this. Oh boy. Okay, you know what? I'm no longer cooked. I'm no longer cooked. I'm great. I'm great. I'm like so great right now. Let's fucking go. Let's go. I'm hoping I get sriracha. Damn it. I know I need to get another item. I'm gonna get some baked goods. Hopefully I get something useful. Good enough. Oh, perfect. Perfect. I can continue adding more books to the collection of books. Because you will continue to get books. Because, oh my god. Another a pre-med. Oh my god. I remember my pre-med days. I was funny then. Well, I was funny. I was honestly, granted, I'm just as funny now, but like, I was funny then too. It's just interesting, like, oh my god, a pre-med. Perfect, they are all PDFs. Lovely, thank you so much. I was like legit worried about that, because like, oh no, no. I've never heard of like an O download link or an O download thingy before. Like, legit. Oh wait, Martin. That was so strange. But yeah, it's a little baby pre-med student. Ah. God. Crazy. Okay, what the fuck item do I need here? I'm hoping that it... Okay, you know what? I'll take that. That's fine. Yes. Yeah, guy... Yes. Yes. So did I. I read Guyton and Hall. I read fucking Leving, or I don't know if I gave you Levings, but I've also read Lippincott. I read Top Hat's biochemistry. I read Guyton and Hall. I read Harper's. I read Langman's. There are so many Burn Levy, and also Ganongs, and Guyton and Hall. You will never be free. You will never be free. These textbooks are the pillars. You will never be free of them, ever. Ever. Oh, no. So when I read out loud. I have to read out loud. I cannot read it in silence. I have to speak it out loud, or else I'm not going to remember what the fuck I just read. That is how I do it. What the fuck? One item per distinct candy. Per meat touching this. You know what? I'll take it. I can see a confirmation with this. I can see something happening. Hopefully not trash. Oh wait. Oh no, I have an idea with this. Ooh, I have an idea with this. I am still gonna keep those items. Yeah, absolutely. Absolutely. Pre-med is hard. Med school is harder. Honestly, actually, other way around. Honestly, pre-med is hard. Extremely hard. Med school is harder just because, like, it's just everything, but in a very small amount of time. You're gonna go through, like, modules and shit that you used to go through in, like, a whole semester. Or maybe, like, in a 4-week block. You're gonna be going through them in a week. Maybe even a day. Maybe even a day. You don't know. It's hard. That's the hard part. It'll be overwhelming, but also, honestly, I find it fun. Finally, a piece of fucking meat. There we go. Come on. Come on. Another piece of meat. Yeah, absolutely. Buddy, absolutely. If you would like, I have an art reference sheet in the Discord. It's on the art reference thing. You can, if you want to print it out, go ahead. I am not, you need to see my wall. I have multiple VTubers on my wall. I have multiple med VTubers on my wall. Multiple doctors and nurses on my wall. Because they are my motivators. I did not expect to become someone's motivator that quickly. Shit. I am low-key shook. It continues. Oh, shit. Oh my god, Love is streaming. Oh my god, I need to end stream soon anyways. I can raid over to her with, like, my few viewers. Ah! This thing keeps taunting me. How dare they? Yes, perfect. Finally. Hopefully fire? No fire? God damn it. But okay, yeah, absolutely. I gotta raid out anyway, so I know exactly who to raid out to. But yeah, once again, I am Spectral Anomaly, second year med student, VTuber, and this close to crashing out on a daily basis. Hope everybody has a good day. I am gonna raid out too. Wait, is she live, ba? Is she live? It's either Shiori or Lev. Like, I like them both. Is she live right now? Is she live? Oh my god, she's live. Okay, fine. How do I raid? Raid channel. What the fuck? The hell? Why is it not doing it? What the hell? Yeah, I'm gonna raid over to her. The raid message is just a shit ton of chicken emojis and to say hi from Spectral. Bye!